Hi, my name's Tabitha. I'm a dental hygienist and I treat patients with All on X fairly regularly in practice. I work in both general and specialist perio practice. I really love using the airflow for treating those patients because it allows me that 360 access, getting underneath the appliance, getting access to the implants, and especially around those really high flanges. So let's have a look at what I can do. So the first thing that I'm going to do now that the Opticate's in, and I've put lip balm on the lips first so they're not stretched out too much, is actually use some Disclosing so that we can identify exactly where the bacteria in the biofilm is. So even when a patient doesn't have their full complement of mouth and they've got a fixed appliance in, it's really good so that we can disclose, teach that patient how to brush those areas at home, but also make sure we're seeing where that biofilm is sticking to on the appliance and where the patient might be having some difficulty with it. So you can see it goes on nice and quick with the pellet. Make sure you do all surfaces. We don't want to just do the buckles. We want to do everywhere so we can really see that we're getting that all off and we're getting it nice and clean. We can put our airflow just onto 0 and that way we can have warm water coming out. And then this way we can see where that biofilm is adhering to and where we need to direct our airflow. And you can see on that lower one, especially around the base of that, we need to get the airflow all in around there. So it really highlights those areas where before, when it wasn't disclosed, it was actually very hard to detect where you might need to clean. So when we're using our airflow, we want to engage our canister. We can work with our powder on between 3 and 4, and we will always want to have our water on the 10. When we're using our airflow handpiece, make sure that you're keeping a nice distance and we're moving it around. We're never holding it in the one spot. I always like to just have an extra oral fulcrum so I can keep that distance really at the same all the time, because the better that we have the distance at the same, we can get more efficiency, and we want to have that movement of the appliance as well. So obviously we need to use the suction. So I'm going to pop 2 suctions in, a low volume and a high volume suction. With the low volume suction, I like to just bring it over the arm and then just have that come in at the back so it stops any pooled saliva. And then the high volume suction is just going to follow that airflow around so we can reduce the aerosols as much as possible. What you really want to make sure is that you're pointing that airflow up in underneath the appliance, and we get into those soft tissues. We have a plus powder, so it's completely safe on the soft tissues. We can clean the appliance with it, but it is really important that we get under here so that any food or bacteria that might be getting underneath there, we can flush out and keep that appliance nice and clean. And then you can change the angle so that we can really get around areas and make sure we're getting that all off our appliance. So see how we can come underneath this flange here of this fixed appliance, and we can really make sure we're getting up underneath there. Now we know that there is an implant placed here, so we really want to make sure we're coming right around on the buccal side, and then you're coming right in underneath on the lingual side, and you're getting both the lingual and the buccal side of where those implants are placed. We do want to make sure we come right underneath that flange the whole way around, but paying some extra attention to where the implant actually is. And then you want to make sure you're coming in underneath and really getting in on those lingual sides. This is probably the hardest side for the patient to clean. And then you can have that airflow. You can't see it as directly in the video, but you can get that really close along there and get right in there and be cleaning in underneath those implants. And then just come back in any areas where it might have stuck onto the acrylic. You can just make sure you're cleaning that off. Obviously, before you do this, you'd want to give the patient some good OHI so that they can see the areas where bacteria is sticking and how they can get to it. On this lingual side, I can see some of the implants, so I can really make sure that I'm getting in there. So If you've got calculus like there is on the lingual here, by using the PI instrument, we're able to move all that without damaging the appliance. And open up for me. And it's also comfortable to the patient as well when we have to really get under that lingual aspect and around the implants. Thank you. I hope everything went okay for you today. You're doing a really good job of looking after everything. All right, so you just saw both the airflow and the PI max in practice. So you could see that I got around those flanges, and it was really important to come around to those linguals and be able to point it up towards the appliance and really get that bacteria from out from underneath. Now, Nick was a pretty good patient, so you didn't see that food flying around, but sometimes for some patients, you really get to push that food out for them as well, which is really good that you can get that. You saw that I got the PI max out at the end because this patient actually had some calculus around. Now, it's really hard to film lingually, but we had some calculus along the lingual and up underneath the appliance. And I was able to angle that tip, which is really gentle and not causing any damage to the tissue underneath there, and get all that calculus out by preserving the denture surface, preserving the soft tissues, but making sure we're not creating a plaque trap for the patient. So it's really great being able to use both of those modalities together and to be able to give that patient that 360 clean when they have their appliances. So you can see by this quick demonstration we've given you today that we really can improve patient care when we're using our GBT protocol. Thanks very much for joining me.